Having seen his father suffer for 20 years of cancer treatment, this painful experience made Dr. Chu Heng Hai realize that there was a need to simplify the task of intravenous drip maintenance. To examine the problem, the intravenous treatment gets interrupted easily. Any movement, including regular activities, can contribute to the interruption of the drip, and the drip must be flushed. This causes problems which include that the IV drip is time-consuming to flush, flushing generates a lot of medical waste, and it increases the risk of needle prick injuries, pain, and infection to both the medical worker and the patient. When the IV drip is interrupted, nurses are called and will attempt to restore the flow with ad hoc methods, such as squeezing, twisting, and milking the tubing. When these attempts fail, the nurse will have to get a new syringe, needle, and medical cotton swabs some distance away at their medical stations to perform the flush on the patient, then walk back to properly dispose of these used items. This process also generates a lot of clinical waste. Poorly maintained intravenous lines can quickly become blocked, requiring a new intravenous site. In our survey, the IV flush activities contribute half the weight of the disposal bins in the medical wards. Globally, millions of tons of medical waste is generated each year from this problem. Innovations in the medical field usually involve usage of additional disposable items. Then, in managing the waste, more energy is used and more carbon is generated, harming the environment and leading to more health problems. The day is approaching when even the most advanced healthcare system available will no longer be able to handle the problems that we are creating. Our solution is the Easy Flush. Easy Flush is a small, 15 American cent medical device that not only improves current treatments but also reduces waste. Easy Flush has two rollers, an ordinary mobile roller to control the drip with one additional roller. When the mobile roller is in the standard drip regulating region, it acts as an ordinary regulator. When the mobile roller pushes to the flushing region, it acts as an effective flushing unit. When the two rollers meet, simply just pull it down to flush the IV drip. The rollers will milk the fluid downward without the use of any other disposable items. The 5 major benefits of using the Easy Flush are that it saves lives, cost, time, resources, and the environment. The Easy Flush significantly reduces medical waste as well as the risk of needle prick injuries by reducing the use of the syringes and needles, which is strongly associated with needle prick injuries. According to the World Health Organization, there are over 3 million needle injuries each year worldwide, exposing the victims to deadly diseases like HIV, hepatitis B, and C, and nearly half of these victims are the nurses. In the prevention of needle prick injuries, ideally, the elimination or reduction of the use of needles should be the first priority. But in reality, has this been the case? Now, with the Easy Flush, nurses can perform flushing quickly and easily while they greet the patient, flushing the IV line before any blockage ever takes place, and without having to use any additional needles or syringes. Intravenous infusion is widely practiced in the medical field, and the need for a better IV drip set like the Easy Flush is a tremendous opportunity. Wherever an intravenous drip set is needed, Easy Flush is needed. According to the CDC, there are over 34.4 million admissions per year with an average length of stay of about 5 days. How many IV lines, syringes, and medical staff will be required for this purpose? In America, where the Federal Needle Stick Safety and Prevention Act mandates the use of sharp injury prevention devices, the regulatory protection is in favor of devices such as the Easy Flush. In conclusion, the Easy Flush rewards every level it touches, from the manufacturer to the patients, the entrepreneurs to the healthcare organizations, and from humans to our environment.